Hello, everyone. My name is Tanya. I'm a professor at the University of Montreal. Happy World Delirium Awareness Day to everyone. Today, I'll discuss a little bit on how to support families in preventing delirium. So why should we even engage families? Well, they are an untapped resource for aiding in the prevention, identification, and management of delirium. They represent the best sources of information on the acute onset and a critical knowledge base on a patient's baseline level of cognitive function, preferences, and personality. Families also express a need and a willingness to participate in their loved one's care, and involving families has resulted in improved patient and family outcomes. So to me, the key components of healthcare professionals supporting family engagement is really to communicate about delirium with families, educate them, explain what delirium is, provide resources for the families, have policies and care practices that are family friendly, and suggest really concrete actions for the families to do at the bedside. In terms of communicating with families, the A to F bundle has a family component, and on their website, icudelirium.org, they suggest really strategies, really simple strategies that you can use to communicate with families. They suggest you use simplified speech, be really concrete, and take your time. In terms of education, well, you can also use this website to find brochures that can be handed out to families or that can support your explanation of what delirium is to a family. They also have videos for families, and the American Delirium Society has a web page dedicated to explaining what delirium is to families. So you can direct these families to these websites. They also usually have videos that can help families understand what delirium is, the experience of delirium, etc. In terms of actions, well, you can suggest that the families do concrete actions at the bedside. For example, remind patients where they are, what day it is, bring eyeglasses, make sure their loved one is wearing hearing aids. Families can also do so much more. They can be provided with detection tools to support explaining what their observations are on the changes in their loved one. They can also be involved in delirium management. So these websites that I mentioned represent resources that you can use to find pamphlets to give to families or better understand how to communicate about delirium. So families are impacted by delirium. They want to be involved. You should communicate to families about delirium, educate them on delirium, suggest really concrete actions that are non-pharmacological interventions that they can do to prevent delirium, have a family-friendly context, and remember that resources exist to help you support family engagement.